And as new variants continue to change the shape of the pandemic, it can be confusing to know what the best health practices are to follow. Utah health experts say while the pandemic changes, there was one thing that continues to be effective at slowing the spread. ABC4's Northern Utah correspondent Cade Gardner has the story.
I have not really taken this off when I've been in any enclosed space with other people since the beginning of this pandemic.
Infectious disease expert Dr. Sankar Swaminathan encourages the continued use of masks.
It's a question of good, better, best.
With the surge of Omicron cases, masks continue to take center stage in Utah politics.
That against Omicron, and it's so hard to change our mindset from previous variants. It's not that we changed, it's that the virus changed. So what we know is that cloth masks do not work at all. I saw one national expert who said they're window dressing.
With all due respect to Governor Cox, he misspoke, and he misspoke in a way that I think is going to cause a lot of confusion.
Infectious disease expert Dr. Andrew Pavia explains why Utahns should continue to mask.
Remember the way that masking really works. The biggest role is when the infected person is masked, so they're not putting as much virus into the environment. And then the mask you're wearing is the second part of that equation. When people around you don't have a mask on, you need a really good mask. But if people around you are masked, then the combination of the two masks provides help.
Dr. Pavia says the best protection is an N95 mask, but says all masks provide some layer of protection. And with Omicron being nearly 4 times as contagious as Delta, he says we should do all we can to slow the spread.
We stand behind that and strongly recommend people, if you're going to an indoor public event where you don't know who's vaccinated and who's not, masks are going to be that best protection for you.
In Ogden, Cade Gardner, ABC4 News.
All right, thank you, Cade.